morning, everyone. Welcome to meeting number 26 of the House of Commons Standing Committee on Procedure and House Affairs. Today's meeting is taking place in a hybrid format pursuant to the House Order of January 25th, 2021, and therefore members are attending in person in the room and remotely using the Zoom application. The proceedings will be made available via the House of Commons website, so that you are aware the webcast will always show the person speaking rather than the entirety of the committee. I would like to remind all participants to this meeting that screenshots or taking photos of your screen is not permitted. Given the ongoing pandemic situation and consistent with public health recommendations, all those that are attending this meeting in person, which no members thus far are attending in person, but there are staff in the room. And I just want to remind everyone to maintain a 2-meter physical distance, to wear a non-medical mask when circulating in the room, and it's highly recommended that the mask be worn at all times, including when seated. Everyone must maintain the proper hand hygiene by using the provided hand sanitizer at the entrance of the room. For those participating virtually, which is everyone thus far, members and witnesses may speak in the official language of their choice. Interpretation services are available for the meeting. At the bottom of your screen, you have the choice of for English or French. With the latest Zoom version, you may now speak in the language of your choice without the need to select the corresponding language channel. Although I think from what we have seen, I would advise that maybe you take a 2-second pause just in your speech before you switch to using the other language. I think that can help with the changeover of the interpretation channels. The hand feature is now also more easily accessible at the bottom of your toolbar, as you can see. And since we are all participating virtually, we should just raise our raise hand toolbar if you like to speak. If you want to raise a point of order, then just unmute yourself and state that you have a point of order. And anyone wishing to speak to that point of order will maintain a list according to the list that's generated through the Zoom application. Okay, where we left off, I'm sure most of you remember our last meeting. We adjourned that meeting, so I'm really at the will of the committee as to what you'd like to discuss today. We do have Ms. Vecchio's motion. We also have 3 motions from Monsieur Terrien, and we have a motion from Mr. Blakey on a possible study as well. So all of those are up for discussion if you would like. Just give me a second here. I'm just getting my toolbox up. Okay, Ms. Vecchio, go ahead.
Thanks very much. And on February 23rd, I had put down the motion regarding the prorogation study, requesting the witnesses. I believe that many members have had the opportunity to speak on this, and we've had over 6 hours of debate on it already. So I believe it would be appropriate to call the vote on this motion put forward. Thank you.
Okay. Are the members in agreement for that? I see a hand up, Monsieur Luzon.
He's muted.
Oh, you're muted, Mr. Luzon.
Ouais. Bon, bonjour tout le monde.
Good morning, everyone. Yes, there is still a fair bit to say about this. I think we need to continue to debate this until we arrive at an agreement.
Madam Chair, you're muted.
Sorry. There we go. Is that better? Sorry. So anyways, I don't see that we have agreement to move to a vote at this time. Hopefully, at some point we will get there. But next up is Mr. Turnbull.
Thank you, Madam Chair. I was just going to show my support for Mr. Lazon and say that I don't believe on this matter, unfortunately. I have quite a few thoughts since the last time we met on this motion, and I'm really, well, I'm displeased that we're continuing with this debate. Unfortunately, I think the opposition parties are, intent on pursuing this matter rather than focusing on what I think is most important for this committee to be focused on these days. And one of the points that I think I need to make more strongly, and I really feel deep conviction for this, is that if the opposing members don't view the response to COVID-19 as a worthwhile reason to recalibrate the government's priorities, then I would say, what is a good reason? I mean, we know that COVID-19 has hit our economy and, impacted the lives of people across Canada more deeply than the 2008 and 2009 Great Recession, I think it's been called in the past. And when you think about the impact, it's I have reports here.
Sorry,
that
Mr. Turnbull. I apologize. Is anyone else hearing an echoing? It could just be me because I think I am having some issues. You are hearing an echoing? Okay.
I am as well, which is, I don't like the echo of my own voice, to be honest.
It was bothering me too, but I was wondering because IT has noticed that my computer is working overtime right now for some reason. I thought it could just be me but I'd wanted to ask because it was not easy to listen to.
Madam Chair.
Generally, your voice is very easy to listen to, Mr. Turnbull.
Oh, thank you. Thank you.
Madam Chair and Mr. Turnbull, I just checked with the technician in the room, and it appears that your Wi-Fi is fine, although I think you're operating over Wi-Fi and you don't have a hardwired connection.
That's correct. Yeah.
So there may be some issues with that. So I guess you can continue, and if it does become more of an issue, we might have to find another solution for it.
If I may, perhaps last time this happened, I have had it happen once before, and I unplugged and plugged back in my microphone or my headset, and it seemed to resolve itself. So maybe I could try that just before we continue, if that's okay.
Sure, that's a good idea. Go ahead.
Mm-hmm.
Okay. How does that sound? Does that sound a little bit better?
So far, so good. I don't hear an echo right now.
Better for me so far.
Oh, there's the echo.
Echoes back.
Yeah, so it's Justin again in the committee room. We are getting an indication that over your Wi-Fi, there seems to be, I guess, a weakness in it. So it's not coming through perfectly clear. We'll get an IT ambassador perhaps to reach out to you to see if we can resolve the issue.
Okay, I tried it again. How does that sound? Is that working? Oh, I see Miss May says thumbs up.
Yeah.
I don't seem to be echoing.
Yeah, it sounds good. Let's give it a go. It seemed like after the first minute, it started again.
Your bandwidth was very low. At least it was showing on my screen, Ryan, that your bandwidth was low.
Okay.
That may be part of the problem.
I normally have a pretty good connection here, so but thank you for that. I think it might be resolved. But if it continues, perhaps I can get IT support, and I'll let someone else take my spot, and then maybe I can pick up where I leave off if that's necessary. But look, so where I was in sort of making my remarks was just expressing this heartfelt conviction that I have that really, if proroguing during COVID-19 is not deemed to be a good reason, I think we have a real problem because when you look at past prorogations, even the one in 2008 and then the one in 2009 that Prime Minister Stephen Harper, used his ability to prorogue at that time, or used his prerogative to do so. All of the comments that were made in the media were that these prorogations were the result of the government's need to assess the economic uncertainty and impact and reset the agenda. I have several quotes from Dimitri Sodas, I believe it is, in 2009 in the Toronto Star. Dimitri Sodas was quoted in saying, with the recession easing now, it is the time to engage with constituents, stakeholders, and businesses in order to listen to Canadians, identify priorities, and to set the next stage of our agenda. So this sort of points to the relationship between, the economic recession that we were under, it's starting to lift, and the need to then reevaluate and reset the agenda, which, is very consistent with, I think, what all leader came to and testified to, and consistent with the prorogation report that we've all seen and read at this point. So I think it's just kind of just the parallel. In comparison, it seems that this rationale was good enough for the general public and members of parliament back in 2009. And what we're dealing with is an economic crisis, a public health crisis first, but an economic crisis that's 10 times greater, at least, than what we saw in 2008 and 2009. And I think that really, to me, underscores that the rationale that's been provided should be and is a great reason for resetting the agenda and evaluating the priorities of Canadians and how to recover from this deep social and economic impact that COVID-19 has caused. And I would say the public health measures that have been utilized to protect to the greatest extent possible human health and human life across Canada. So I would like to actually reference a document that I've been reading, and I think it's really pertinent to our discussion today, or our debate. It's the 6-month update, the social and economic impacts of COVID-19. It was published in September 2020, and it was published by this chief statistician of Canada. And it's a sizable document, so I wouldn't blame anybody for not reading it, and yet I found it very interesting. It's 134 pages, and it outlines the really deep social and economic impacts of COVID-19 that we were all dealing with at the moment in time when our Prime Minister decided to use his prerogative to ask for prorogation and reevaluate the government's priorities and reset the agenda. So I think this document, anyone can access it. It's publicly available, and it's extremely useful in terms of outlining the depth of the impact on our economy. And I want to draw your attention to a number of points here that I think also are really reflected in the throne speech, which I remember in our last meeting, I spent quite a bit of time delineating how the consultation process during prorogation really in-depth and thorough. It really engaged members of parliament. It engaged other parties in the discussions, and really looked at what data and evidence we had, what the priorities should be. And I feel the throne speech, although broad strokes, of course, with some continuity for sure from the original priorities that were outlined in the platform, prior, and even continuity with the previous throne speech, that it largely reflected the needs that were expressed by my constituents and I believe Canadians in general. And I would go even further today and say actually the needs that were reflected in the broad strokes of that new throne speech actually respond effectively to the major impacts that were outlined by the Chief Statistician of Canada in this 134-page document that I think is an incredible body of work. I'm not sure how many people it must have taken to produce such an in-depth report, but I'm sure there was a lot of people behind putting this together. Really useful. In the foreword, I'd like to quote something that I think is really important to keep in mind, and it highlights the need for an inclusive, equitable recovery. And the Chief Statistician of Canada wrote this forward, so it's a quote from him. His name is Anil Arora, and he said, "The crisis has also laid bare many of the social and economic hardships facing marginalized Canadians, raising fundamental questions about the inclusiveness of the recovery." So that's one piece of, I think, an important argument to be made, which is to look at that statement, look at the evidence, and really look at how the throne speech responds to that and how it outlines an inclusive, resilient recovery plan. Again, in broad strokes, because the throne speech we know is not a detailed plan. It doesn't outline every single thing the government is going to do in full detail, of course. I don't think that would be reasonable for us to expect in a throne speech. I would also say that Anil Arora says, responding effectively to a crisis requires timely, credible information. COVID-19 has substantially increased the demand for data and analyses that illuminate the challenges facing Canadians as households, businesses, and government gravitate to a new norm. There's lots of really good information in this document, and I'd like to just start by highlighting a few of the key findings that I think are really pertinent. So one of the key findings is, and this is on page 4, the health impacts of COVID-19 go beyond the effects of the virus. So one statistic that I think is worth pointing out is the pandemic has had unprecedented impacts on the quality of life of Canadians who have reported their lowest levels of life satisfaction since data became available in 2003. So that's one point, is that people report, and that's self-reported data. So, and I would say people's perceptions of their life satisfaction is the only thing that matters when doing that type of research. It's their perception of their quality of life. It's a good indicator of how much this has impacted Canadians. Also, fewer Canadians reported being in very good or excellent mental health, with young Canadians registering the largest declines. Also, the report points out what they call excess mortality. That's kind of a strange term, but it essentially, looking at population level data, we would be able to predict the kind of anticipated mortality rate of Canadians. And they've graphed that out, and they've shown just how many more deaths there have been during this crisis than what would normally be anticipated in the normal cycle of life of Canadians. So that's another statistic that's in here that I think is very important. Another key finding is that the economic impacts of COVID-19 have been uneven across population groups. This is really important, I think, for us to realize, and I know that my many other colleagues feel just as passionate as I do about the importance of supporting segments of the population that are marginalized, and that we're have been disproportionately impacted by COVID-19. The report says the historic declines in economic activity disproportionately affected many vulnerable Canadians, including women, youth, new immigrants, visible minorities, and low-wage workers. It also says that visible minorities are overrepresented in sectors hardest hit by the pandemic, including food and accommodation services, contributing to higher rates of unemployment. We also see the data point impact on Indigenous populations, and the statistic is 36% of Indigenous participants in the research reported that the pandemic had an impact on their ability to meet financial obligations or essential needs, compared to 25% of non-Indigenous participants in the research. So that's a significant increase. That's 11% over non-Indigenous individuals that participated. So this points to the inequity that we're seeing within the pandemic itself. And I think part of how that pandemic response needs to reflect the inequities that we see across the impacts. So let me go even a little bit further here. The impact of COVID-19 on economic activity has been unprecedented and highly uneven across sectors. This is another point that the chief statistician said was a key finding of this extensive report. So again, think back to the throne speech that outlines supports for hardest hit industries. I would add here that we're still trying to get that support through Parliament, and some of the essential supports for the hardest hit industries, actually passed through the House of Commons, which is unfortunate that is being delayed. The impact of COVID-19 on certain sectors, particularly those that provide consumer-facing services and rely more on travel and tourism, has been particularly severe. Lower wage services have been impacted to a much greater extent than high wage services. So this means that, individuals who are staffing the firms that offer these lower wage positions are ones that are also being impacted because the economic impacts are hitting the service sector and consumer-facing services much harder. I think we've all seen that in retail, probably in our local communities. I've certainly heard it from my Chamber of Commerce and my business improvement area over and over that these are the industries that have been hardest hit. The recovery in jobs will depend in a large part on the ability of many businesses to adapt to changes in financial and operating conditions, including more uncertain demand of their products and services. And the report also goes into how this pandemic is having a transformative impact on existing business models. So similarly, businesses are having to shift, they're having to digitize or digitalize, I think is the more appropriate term. Obviously, more people are teleworking, and in some instances, some of these lower wage workers are also at much higher risk of having robotics or automation replace their jobs. And this is a big trend within this report as well. So in fact, there's many risks and many impacts again that are on those lower wage workers that the rest of us who are higher wage don't feel and experience to the same degree. Airline passenger volumes measured year over year remain down 94% in June. As of July, payroll employment in accommodation and food service industries was about 2/3 of its pre-COVID level, so down 1/3. And again, these impacts were at that time. So this report really outlines the impacts between when the pandemic hit and basically August. The report was produced in September, So it was actually used as a platform of foundational data that could then, help inform the consultation process that was being undertaken at the same time. So I think this again points to, and if you keep drawing the lines between what the data tells us and what the throne speech says, I think you understand that, that we're not making this up. It made sense. It was rational. It was a good thing to do, is to pause and reset the agenda and evaluate where we were at. So one of the other key findings that I think is important on the social impact side was that the social impacts have also been uneven. So greater impacts on those population groups with pre-existing vulnerabilities. So this included immigrants, visible minorities who are overrepresented as frontline workers, which I've already said, but they were also put at greater risk of contracting COVID-19 because many of them were on the front lines working throughout the pandemic. Also, I think it's important to point out that the data showed that visible minorities had perceived and self-reported an increase in harassment, attacks, and stigma since the pandemic began. And the rates were highest among Chinese, Korean, Southeast Asian participants. And I take this very seriously, that if the pandemic, so not only are visible minorities working in the pandemic on the front lines, more hit by the economic impacts, more putting themselves at risk of contracting COVID-19, but also experiencing harassment, attacks, and stigmatization as a result as well. It makes me actually want to, I'm really not happy, obviously, about this. It's very hard to I think, shoulder this and even process it, because it's exacerbating vulnerability on top of vulnerability, and really, I think, providing evidence as to why we might see this resurgence in movements that are seeking greater equity for populations or subpopulations that are vulnerable and highly impacted by COVID-19. Also, I think it's important to note that social isolation due to COVID had heightened the risk of family violence. And there was a 54% of respondents from victim services reported an increase in the number of victims of domestic violence served between mid-March and early July. So again, this highlights quite a few different important findings that I think if you look at the throne speech, you'll see, again, you can make direct connections between what appears in the throne speech and some of the data that's been collected. Another key finding is managing the pandemic moving forward. Canadians are willing to take precautions to slow the spread of COVID-19, but there are differences across groups, and that was apparent from the data. So one example was 90% or more of Canadians said they would take precautions such as hand washing, avoiding crowds, and wearing masks. What I found encouraging about this particular portion of the report was that it shows how much Canadians in general, I think, how much they're willing to do in order to protect the health and lives of others. And that to me is very encouraging, to think that we have data that shows. Now that data was shown to fluctuate depending on the severity and the number of cases that people were aware of. So you think about how public health keeps reporting our daily numbers, and how some of our extremely reputable doctors are putting that data out there to keep us all informed. That actually impacts Canadians quite a bit in terms of their willingness to protect others and take the pandemic seriously. It's really important that that data is put out there because it showed the data that the chief statistician gathered shows that it does impact what people are willing to do and kind of give up in terms of the disruption to their lives, because they understand that as case numbers are increasing, that they've got to do more and they've got to, abide by these public health measures. And there's a larger degree of compliance as a result of them being aware of the case numbers going up. These are all obviously, I think, important points for us to keep in mind when we're thinking about the rationale for prorogation. And again, making the link back to, well, I'm not being unreasonable here. If Prime Minister Stephen Harper prorogued for a recession that pales in comparison to this pandemic, then certainly the economic impacts of COVID-19 would merit the same consideration and provide a perfectly reasonable rationale for proroguing Parliament. There were some other findings here that I think are important. I'll try not to repeat myself. Changes in Canadians' concerns and response to COVID-19. As restrictions are lifted and activities resume, social interactions increase, particularly among youth, Canadian-born, and those living outside central Canada. There are some other findings here. Concerns remain about resuming certain activities, such as attending events, traveling by airplane, and gathering in large groups, particularly among seniors, immigrants, and Ontarians. Many Canadians at high risk of severe outcomes due to COVID-19 said that they would try to continue to work from home. There are many other findings, but I think what we see is that as restrictions were lifted, the compliance to some of those public health restrictions are less, and as such we've seen a second wave emerge, and now we're probably on the cusp of what we would call a third wave of COVID-19, which is deeply concerning. Now, let me just see here. I had a few other points that I wanted to make. Yeah, there's about the health risk of resuming activities and willingness to take precautions, which I think is important to highlight. So again, what I think is important to note is that the throne speech recentered on the health needs of Canadians. And that's why the throne speech, if you actually look at it, it really does focus and is structured in a way that, I think, again, I said this before, that we all were quite excited between the first and second wave. I certainly felt an energy of, oh, great, like we're coming out of this. And then I think it quickly came grinding to a halt when we realized for sure that there was going to be a second wave, which I think any person that's studied pandemics would have been able to predict, and so I don't think it was actually all that surprising. But I can definitely tell you, I certainly was caught up in the thought of focusing on recovery and addressing the inequities in our country and many of the other issues that I think coming out of this are going to be important. But when you look at how the throne speech is structured, it gives an overview of it has four foundations. The first one was protecting Canadians from COVID-19. The second one was helping Canadians and businesses through the pandemic. Build Back Better, which I remember one of the witnesses calling a catchphrase. I have lots and lots and lots to say about that. It's not a catchphrase to me. It's a really important concept that is an inspiring vision for a new economy that can emerge stronger, more resilient, more inclusive, more equitable, more sustainable for the planet. And that is something I would work till the day I die to achieve. It's something I believe in. So, and then the last one was stand up for who we are as Canadians. And so that's how the throne speech was structured. And so it really centers on, protecting Canadians first and foremost from COVID-19, and then talking about how to get Canadians and businesses through the pandemic. And then, how do we recover in terms of the Build Back Better and stand up for Canadians? So, I really do feel like it reflects a lot of the data, even just in the way that it's structured. So I'm going to make a few more points here about the concerns about overwhelming the healthcare system remained at that point, and ensuring that we made workplaces safe. Approximately half of high-risk individuals who were employed rated their risk among employed individuals higher. So in terms of absolute numbers, sectors with the highest estimated number of workers at risk of adverse outcomes of COVID-19 were healthcare and social assistance. That's not surprising, given those folks were working on the front lines and caring for people during the pandemic. Retail, trade, manufacturing, construction, professional, scientific, and technical services, and transportation and warehousing. So you can see how many of these were considered essential services, and those individuals were definitely of higher risk of contracting COVID-19, and in many cases had underlying health conditions. We're also at greater risk of having underlying health conditions as well. Madam Chair, I would just like to skip to another section in this report, which I think really speaks to the economic impacts and the depth of the economic impacts. So this is on page 44. Actually, maybe I'll just cover the summary. The summary is on page 43. So economic impacts and recovery related to the pandemic. So output is recovering as businesses reopen. So again, this was written in a time where some businesses were able to reopen to a degree. But there were stark differences across the sectors. Output in accommodation and food services in June was at 55% of its pre-pandemic level. Another finding was that employment is recovering, but steep losses remain in certain highly impacted sectors. Again, youth, less educated workers, women, recent immigrants, and temporary employees were hit the hardest. Prior to the pandemic, this is a summary, and I have more detail on some of these points that I think is important, but firm creation, so this is the start in the startup space. It was, so before the pandemic, new firms being launched, new businesses being launched, they were on the upswing. There was a rise in the number of businesses that were being started in Canada, and the financial position of firms was improving. Closures rose dramatically during the shutdowns as employees left their payrolls. 62,600 business closures were observed in May alone, with 29% less than in April, but still 9% higher than pre-COVID-19 levels observed in February. So, and it's important to remember that those shutdowns weren't complete closures of those businesses. They were shutdowns due to the public health measures that were implemented by provinces and territories to protect people from contracting COVID-19. There's also structural challenges in heavily affected sectors. The retail sector rebounded quickly from storefront closures as companies developed and enhanced their online platforms. So some of them were able to move online, and they did rebound somewhat. Again, nowhere near their pre-pandemic levels, but still there's good sign that that those businesses can pivot and start to change their business models and rebound somewhat. So in terms of the unprecedented impact on the economy of COVID-19, we can see unprecedented declines in output. And there's actually a really great graph on page 44 of the report that I keep referring to, which shows from 2007 to 2020, and just what the output in our economy has been doing during that time. So you can see on the graph the size and scope of the 2008-2009 recession, which where annual GDP fell 2.9% in 2009. You can compare that to the economic growth over the period of 2018, 2019, and even prior to that, there's considerable economic growth. And you can compare that to the COVID-19 pandemic with severe declines in household spending, business investment, and trade, all of which amounts to, at the time, I think about 5 times the impact of the 2008 and 2009 recession. The chief statistician or the team that wrote this report, I don't pretend that the chief statistician necessarily wrote the entire report. They probably had a team of people helping. It says, as a purposeful policy-based response to a health crisis, the COVID-19 restrictions brought about severe contractions in most industrial sectors, including in many service-based industries that typically support the economy during conventional downturns. Just as another note that I think is important to recognize, and I have some other articles on the difference between 2008, 2009's recession and the panic, the COVID-19 pandemic. There's a great article that was in First Policy Response, which compiles a whole bunch of different experts that talk about how COVID-19, the economic impact of COVID-19, is far greater and much different qualitatively than the 2008-2009 recession. So in 2008 2009, the recession was a demand side recession, totally different than what we see in COVID-19, which is a supply side shock recession, which is very, very different. So you would expect not only is it much greater, but that it's different in kind. It requires a very different set of measures, a different way of thinking, and a different, set of policies and strategies for dealing with it. So I won't go into depth on that right now, but I think that's important. I think it's also important that the chief statistician outlines that the road to recovery will involve major adaptations for businesses and households, which poses challenges for an equitable and resilient recovery. And that's interesting too, because you think about how we've identified that the impacts of COVID-19 have not been equally distributed. In fact, they've impacted populations who were already marginalized or vulnerable much more. And then I think the chief statistician is also saying that creates additional challenges for our recovery. So in quarter two, household spending fell. So this is in 2020. In quarter two, household spending fell by a record 13% as families faced heightened levels of job and income uncertainty. Employment earnings fell by almost 9% in the second quarter at the same time. And household disposable income rose by almost 11%. This is really important for us to think about recovery, to see that household spending fell by record 13% as families faced the uncertainty of the pandemic and income loss. And employment earnings fell almost the same amount, not quite, but 9% in that second quarter. But at the same time, due to the government's, our government's measures and supports, COVID-19 relief, economic relief, or financial relief supports, disposable income rose by almost 1%. That's interesting when you think about the elasticity of a market and the supply side shock on the economy. When you put out money into the pockets of Canadians to help them get through a crisis, and to some degree there's an increase in their disposable income, they're not spending it, right? So this pushed the household savings rate just over 28%, up from about 8% in the first quarter of 2020. And again, this is what, when the Prime Minister keeps saying that the economy is going to come roaring back, this is what we're talking about. Why is it going to come back? Why are we seeing already the chief financial advisor, I believe it is, for TD and CIBC? I've been putting these bits of information out there as I see these articles, but they're already saying that the rebound of our economy is starting to happen, and there's evidence of that. So again, this is the result of severe declines in most types of economic activity, but in terms of our fiscal measures and support measures, I think we can see that they were targeted. And some of those were outlined in the throne speech. Some of them were continued on, but a lot of them were restructured around that time as well. And if you remember, the wage subsidy, for example, was completely restructured to be kind of indexed to the revenue loss of the businesses that are out there. And that makes perfect sense. And I know I think we all agree. I think opposition parties were in agreement that those revisions and adaptations of that support were important to both support businesses to get through this, but also to help the support be structured in a way that allows them to actually recover and actually kind of lifts those businesses out of the pandemic and the impact on their business that's created. So to me, again, this just seems like it's all very rational and evidence-based to me, and I know that's what I sort of hang my hat on, is that as a party and as a government, that we've been putting the health and safety of Canadians first, and we've been seeking evidence and consulting with key stakeholders across this country, including opposition parties, and attempting to implement measures that are effective, that are the most effective at both protecting Canadians' health and safety, but also in helping our economy recover and the number of Canadians get through crisis. And to me, that gives me reassurance. Let me see here. I think I covered that one. Historic declines in labor market activity were another impact of COVID-19. So employment losses totaled 3 million from February to April, almost 2 million of which were in full-time work. This is on page 47 of that report. Employment rose by 1.9 million from April to August. Total employment in August was 5.3% below its pre-pandemic level. This shows, how quickly, businesses and employment started to recover, or unemployment started to decrease as we came out of the first wave of COVID-19. It still was below pre-pandemic levels, of course, because we hadn't gotten through the crisis yet. And certainly we know now that the second wave of COVID-19 was much worse. So this the impact on our economy has only gotten greater as a result of managing this crisis through the second wave. And now perhaps if we have a third wave, which I think could be avoided, quite honestly, if we stuck with our public health measures and didn't lift them prematurely, I think we could avoid a third wave, which would benefit our economy and all Canadians, as well as, of course, the health, which is the most important part of dealing with a pandemic, is the health and safety of people. You know, I was really heartened by the fact that the Prime Minister called for March 11th to be a day to observe the incredible loss of life during COVID-19. And, you know, I don't know how many people have been impacted by this exactly, but I know that it's 22,269 people have lost their life in this pandemic over the last year. And I think about the ripple effects on all of the people that are in their families, all of the friends, all of the communities that are experiencing those losses. And I think we need to remind ourselves that every life matters. Every single life matters. We can't ever become desensitized to the loss of life that's occurred from this pandemic. And so while most of my speech is focused on the depth of impact on our economy and on our society, I mean, I really think that, you know, the impact and the loss of human life is something that we can never lose sight of. You know, maybe I'll leave it there for the moment because I have so much more to say and there's so many more good points in here, but I think that might be a good time for me to take a moment. I feel myself getting a bit emotional, which I think is natural given how hard we've all been working for so long and how long I've just spoken for, and the I think the reminder, the heartfelt reminder of the loss of human life that's happened in this pandemic that I take very seriously. So thank you, Madam Chair, and I'll maybe resume again after some of my colleagues have had a few words, but I think that's a good place for me to stop for the moment. Thank you.
Thank you, Mr. Turnbull. And I could actually sense the emotion in your words and at this point as well. So thanks for your speech. Monsieur Lauzon.
Merci beaucoup. Merci, Madame la...
Thank you, Madam Chair. And thank you for showing us the human side of this pandemic. This really sets the stage for what we need to speak about. One can't remain insensitive to the reasons why we're here. This is an historic situation, and it's also a life experience. We will be a part of history. We will have to say one day that we were here. We had to make the right decisions. And that's why I would like to speak to the importance of prorogation, to the importance of being here and discussing this following the tabling of a motion. We should be putting our energy elsewhere.
Your mic just a little bit.
Yeah. Is it better like this?
It's still maybe, is this mic plugged in?
Yes.
Okay. That sounded really good.
Let me check. Let me check the.
No, you sound much better now.
Okay, now, okay, I'll just raise my mic a little bit.
Let's just verify it with the clerk.
Okay, clerk, can you tell me if my mic is loud enough?
Monsieur Lauzon, c'est beaucoup mieux ça. Donc vous pouvez...
Mr. Lauzon, that's much better, so continue, please. Thank you very much. On the 10th of December, I was at a committee meeting And we were speaking about the motion. And Ryan really set the stage when he said that if a pandemic doesn't merit a prorogation, I don't know what does, actually. Because, as I was saying earlier, we are going to be a part of history. Could we have foreseen this a year ago? Could we have foreseen this when we'd only been elected for a few months? We were all busy in our ridings in the House. There was life on Parliament Hill. There was life in the lobbies. And we were always shaking hands with each other, speaking in person. And now, today, it's all almost 100% virtual. There's a small percentage of people there. But right now, the committee room is empty, minus the staff. So we're all appearing virtually. We're all speaking virtually. And no one could have foreseen this. No one. Now, today, this committee has a more important role to play than ever. We have a list of issues and files that we need to review within this committee. And that being said, we have to modify this list because today our priorities have changed. We have seen what we have to do in the way of procedures. And we should be one of the most active committees right now, besides the Health Committee, because this is a health issue, obviously. But we need to be one of the most involved committees right now. We have to be one of the most dynamic and active committees. We need to be showing the public what we can do in terms of procedure, how we can do better as a government during a pandemic. Now, there was a motion that was tabled that we're discussing, and that doesn't do what I just outlined. Prorogation is being used as a pretext to have a motion that will prove that we shouldn't use prorogation. And what's unfortunate is that this is really getting in the way of the terrific way the government could be working, has been working. And the opposition members have tried to show that it's because of the We Charity affair that we prorogue, despite the fact that many witnesses have spoken to this. And they won't let go. They're witnesses who do not agree. They said that it was necessary to prorogue in order to be able to move forward and come to pandemic-related decisions. And it also had to be done to allow the government to realign itself with the right priorities for Canadians. Let us not forget that this government proposed to draft reports on the reasons for prorogation once that prorogation had happened. And we did explain the reasons why this prorogation had to happen and why it was necessary when it was in these unprecedented circumstances. And I'd like to quote from Kathy Brock's testimony. She is a professor at Queen's University. And she spoke to the reasons why one would prorogue. First, she said yes to reset. And that's what we were doing. We were resetting. But she also said that it gives the government an opportunity to refocus its priorities when those have to be highlighted and changed. And when one looks at the situation in 2020, there was a government that was tired, that was under an enormous amount of pressure. And the government has to be able to reset so that it doesn't fail. Mistakes can be made when there is a considerable amount of fatigue, and so the government has to be able to recenter, refocus. You know, this may seem trivial. However, I didn't have an opportunity to undertake in-depth studies when I was young. I was a welder for a large part of my life, for 21 years actually. I went back to university. However, what I want to tell you about the psychological fatigue that one can experience in a workplace. There are different kinds of fatigue. There is psychological fatigue. And psychological fatigue is what we're experiencing on a daily basis now. Every day we're in touch with our constituents. We're working on committees. We're listening to witnesses. And during a pandemic, there isn't much that is positive for everyone. We're all in our own small circles. We're working all the time. It's very, very tiring. But we still have to show citizens that we're human, that we're listening to them, that we're strong, and that we're going to keep going. Personally, I was very affected by this because throughout the pandemic, I was and still am the parliamentary secretary for elders, for seniors. And when I see anyone trying to score political points on the backs of seniors, I'm very, very hurt. Everyone is hurt. Do you know, there has been this building pressure. And I'm just talking about the psychological side of this. I could speak to you for a very long time about the psychological aspects of this fatigue. Our committees are going to have to work very hard. We're going to have to talk about social isolation. We're going to have to talk about the psychological disruptions that occur during a crisis like this. And as you can all see, we're all sitting in good places, homes, offices. There are some people who have beautiful spaces to work in, but that's not the reality out there. I've had Zoom meetings with presidents of associations and other people who have to sit in a tiny, tiny room because their 3 or 4 children are throughout the house. They have to find a spot where internet is accessible. And this isn't to mention all the family pressures. As a matter of fact, I'm going to come back to the related importance of our PROC committee. We touched on this at the last meeting, and I thought about it. I thought about everything that might help family life work balance. And I'll speak to you about that a little later. Right now, what I wanted to talk to you about was how much I've been thinking about since I joined this committee. But I'd like to come back to this issue of psychological fatigue and how it affects us. Do you know, you end up questioning yourself. Am I in the right place? Am I doing the right work? It has an impact on colleagues, on your own performance. It has an impact on your sleep. Do you know, even if we're members of parliament, sometimes we also suffer from sleep disruption, and that has an effect on our health. The pressure has an effect on our health. It can have an effect on any diabetes or any other, for example, hidden health problems that we may be suffering from. So it doesn't help these health issues when you're suffering the stress of the pandemic-related pressures. And what Kathy PROC also said, the professor from Queen's University, was that what this helped us with, somewhat, it helped us to catch our breath. Was it the right time or not? Well, that's also been discussed, and it could be discussed even further. I can speak to that later. But I think the timing was right. Ryan explained why very clearly. He spoke about the first wave and the second wave. But I'm speaking to you about fatigue. I've spoken to you about the psychological distress that we've experienced. And I think the professor was clear in what she had to say. But there's also exhaustion, physical exhaustion, long hours in meetings, meeting after meeting after meeting, speaking to people. We're always being asked questions, whether it has to do with vaccinations or other issues. I chose to be in politics, it's true. But we have to be able to work together. We mustn't miss opportunities to be able to work together. We mustn't use opportunities like the pandemic to play politics. I sometimes find it very unfortunate, very unpleasant when I hear certain lines repeated over and over again, whether it's things we say in the House that are then repeated in the media. I think that we need to face this pandemic together. And we shouldn't be using it to play politics. There are many other issues that can be politicized, it's true. The House continues to sit. And it has had to. Look at all the programs we've had to roll out for the purposes of the pandemic. And we have collected ideas from everywhere. We have consulted extensively. Just take the New Horizons program. We consulted with all the parties in order to find out how we could improve our work so that seniors could benefit from programs in ridings throughout Canada. We wanted these programs to be in all the ridings. Many opposition members spoke to, for example, other programs or raised issues in their own ridings. And we've received emails from many members of the opposition. And we, I would like to say again, consulted extensively. We added $20 million for seniors during the pandemic. These were all projects, all undertakings that were done for the purposes of breaking their isolation, whether it had to do with providing internet, iPads, showing them how to communicate via Zoom, Facebook, small training sessions. There have been all kinds of fantastic endeavors in ridings. For example, yoga over Zoom for seniors to help them move in their small, isolated rooms over the past several months. Do you know, all they had was a sink, a bed, and a chair. These seniors have experienced physical distress. And that's the kind of distress that Ms. PROC raised as well in her testimony. There is exhaustion everywhere. There are young people suffering as well. I mean, they've never watched as many televised series and played as many video games probably as they have in the past. I want my children to make friends, to get out and play. You know, we're social beings. And we have kids who were involved in activities, but today they are inside. They're in their rooms. They're playing games, they're playing video games. And it's not healthy psychologically to spend hours doing this. It's all very well to introduce them to painting and music, etc. However, we're isolated, and our children are isolated. So they're suffering from psychological and physical distress. And so what did prorogation do? Well, it allowed the government to step back and bring in new adapted priorities for Canadians. Tackling COVID is one thing, but there's also the issue of the economic recovery. Ryan raised this, and he made some very good points about the economy. Many things have been done. $300 billion. You know, you have to do many, many things when you're spending that. Was it perfect? No, it wasn't perfect. Nothing's perfect in a crisis. When you're in a rush to make the right decisions, we debate these decisions regardless. 338 MPs could not have foreseen certain things, like a worker having to come back and quarantine before going back to their job after they were on vacation. We couldn't have foreseen these kinds of problems. We didn't know that there would be agencies selling discounted trips to the south, and then there would be this hot potato issue, actually, of people coming back. We didn't know these things would happen. Sometimes you need to step back in order to make the right decisions going forward. And that's why I'm saying that psychological fatigue and physical fatigue mean that one can end up making mistakes. And in politics, there isn't much room to make mistakes. I don't have the statistics in front of me, but we've been asked many, many questions in the House about travelers coming back to Canada. And I have received so many emails, and I have responded to countless emails about the money required for their quarantining. But we had to make decisions together. We had to live with our decisions. And the opposition has tried to show how bad our decision-making has been. And today we're discussing prorogation. And we're being told that there shouldn't have been one. But you've already decided, the opposition has already decided why prorogation happened. And many members of the opposition have said that prorogation should have happened at the beginning, even though we didn't know what was going to happen down the road. Even though we didn't know that there was going to be a second wave and new variants. Even though we didn't know at the time what would be happening with the vaccine negotiations and rollout. The only thing at the time that we knew was that we had to work with 7 different vaccine providers and manufacturers. We knew that we had to try and build the greatest capacity possible when it came to vaccinating Canadians. And all one was hearing was, well, we weren't doing anything, that we were incapable as a government. All the people were talking about was the $1,000. And so I think we've missed opportunities here. We should all be trying to show Canadians that we're working together to tackle this pandemic. And I'd like to go back to Kathy Brock's testimony for a moment. The professor at Queen's University. She spoke to the reasons for proroguing. And she said that prorogation allowed the government to step back and to bring in new priorities for Canadians. In other words, how to tackle COVID-19 and how to allow the economy to recover. My colleague, Ryan, spoke to this. It has been so important since the very beginning to think about this, to think about the impact on our economy. That is to say, our businesses, our small businesses, for instance, in ridings like my own, in rural areas. There are small, micro businesses. They're the biggest employers, actually, in rural areas. You know, if there is a plant that has 40 employees in a rural riding, well, that's fantastic. You know, there's no public transit. We're not building higher than 3 floors high, for example. Many people don't have high-speed internet. So that can give you a picture of how isolated people may be and how important it is to collaborate and to think about these rural regions during a pandemic. So it was necessary to step back and to get a better picture of what we needed to do and to refocus our priorities in the face of the pandemic. So when I talk about decisions, one may be inclined to say, well, we were just sitting back and twiddling our thumbs during a prorogation. But we were talking about what was going to happen after. We were consulting. We were talking about economic recovery. And this economic recovery is going to happen through our decision-making. I think that PROC really does have a role to play. And I've kept some time to be able to speak about the importance of our committee. What I can say now is that when it comes to procedures, we have a lot of work to do besides playing politics and getting in the way of the work the government needs to do with motions like this. From the outset today, there was a proposal to vote, but then we wouldn't have been able to debate and to speak. We need to continue to speak together, work together, without harming government's work. The study on prorogation started in December. There were about 12 witnesses. And then vaccinations started. Now these vaccines are being distributed throughout the provinces. And we can see some light at the end of the tunnel. And I believe in that light at the end of the tunnel. I can't wait. I can't wait for that. I've been waiting for it for a long time. And nothing's going to be normal because there are so many procedures that still have to change. You know, life won't be like it was before. I don't know how long it's going to take before I can see you all in person, before I can give you a good, sincere handshake. Do you know, I was raised with good handshakes. Do you know, the best sign of good feeling and a good feeling about life and about each other is through a handshake, through a high five. But people aren't going to be as willing over the next few years to just extend their hand for a handshake. Our way of doing things will have changed, and issues of proximity will be different. There's fear now. There's fear that is here now and that will remain. It's a sad thing to say, but that fear will persist. We heard considerable testimony. Some said that prorogation shouldn't have happened, that it was a way of getting ourselves out of a situation. Well, it's true that we were working in a difficult situation. We needed to work on that situation. But now there's this preconceived idea that we didn't do this for the right reasons. There are witnesses, you know, who weren't experiencing what we were experiencing here on the ground, out there. There are things that people can't necessarily experience unless they're an MP, because as an MP, we're speaking to our constituents all day long, over the phone, all weekend. And let's say you're in Toronto Centre, or let's say you're in the national capital, where most people who work there are working for government, for example, and are doing telework. Their salaries haven't suffered. They've been able to work from home with the help of the government. Obviously, the distress isn't the same. But we're speaking to people who are experiencing all kinds of distress, and that distress can have to do with family or finances. And in this case, it has affected both. It has affected more than that. It has affected the person, their finances, and their family. And there are people who have lost their jobs. There are people who had to close their businesses, then reopen them, and then close them again, shut them down, and then open them up again. It's been very, very difficult for these individuals. I know producers who had to throw out so many edible products, for example. We helped many of them bring their produce to food banks, but you can't bring 20 tons of potatoes to a community center. They don't have the ability to accept all that, to receive 6 truckloads of potatoes in a food bank. The system isn't made for this. The system wasn't made for a pandemic. 10,000 chickens had to be buried. There were chickens for restaurants, for example, that weren't appropriate for other areas. And so some of these chickens had to be killed and buried in my riding. These are very difficult decisions to make. Nothing's perfect. Ferries as well. Ferries were forgotten for a while. They were affected. They were affected from the outset. And there was flooding in Quebec, in my riding. 7 municipalities were affected by flooding in my riding. The year before, I had my big boots on. I was at the edge of the water helping citizens. We were all helping people get the material out, save animals. The Army helicopter came to help get people out, get residents out, because a dam was about to collapse. So we had to evacuate quickly. We had to move quickly with Army helicopters to get people into community centers. But there were horses, dogs that we had to abandon. These are things that I experienced in my riding. So now today, we're still tackling this pandemic. But there are many who are affected by the crisis the year before, and they weren't necessarily eligible for all these programs. We tried to design these programs as best we could, but nothing's perfect again. And so it helps to step back. It helps to reflect, to look at the data, to speak to decision makers, to talk about how we can do better, and that's what we did. And we heard testimony to that effect. However, opposition members continued to say during the meeting on December 10th and the 28th of January as well that we prorogued simply because of the We Charity affair, that's why we prorogued, for that reason alone. So they already had a preconceived idea before the study even began on the August prorogation. So they already had made up their minds. But we have all we need now for a report. There was considerable testimony that showed that the pandemic was sufficient reason to prorogue. This was an unprecedented crisis. This was an unprecedented health crisis and economic crisis. And it had a major impact on the lives of Canadians and took the lives away from many people, of many people throughout the country, throughout the world. And don't forget, we need to help other countries. We don't want this to come back. We don't want this to come back in another form or shape. We're fortunate here in Canada to have the system that we do have. We're fortunate in my province to have the system that we have. But I can tell you that we have realized throughout this how fragile our system is and how easily such a strong system can be broken in some ways. Yesterday was International Women's Day, and so I wanted to dedicate that day to the women on the front lines, women who have been working so hard from the very beginning of the pandemic. I wanted to think about them. These women who were suffering from precisely those fragile parts of the system and that were apparent in an unprecedented way because of this health and humanitarian crisis. It looks like nothing will change no matter how many times this is said to members of the opposition. I've realized that. Maybe I'm a new member of the committee, and you can say what you will, but I think minds were made up before we even had these meetings. And as a new member, I can say this because I had to look at the report, I had to read the report, analyze it, think about it, bring myself up to date. And what I will say with respect to this unprecedented crisis is that prorogation had to happen, and the opposition ended up deciding to simply confuse Canadians on why prorogation happened. Members of the opposition already have their preconceived story. And I can see this when I see the kinds of questions that are being asked, because I did have an opportunity to look at the questions that were asked, and one can see very clearly that there was a preconceived idea, that minds were made up. And oftentimes, there was an attempt to get answers that were negative about the prorogation. So that's what I'm thinking today. That's what I wanted to share with you. And now I'd like to speak about the report a little. I'm talking about the report to Parliament on prorogation in August. It's several pages long. It includes appendices. It's a prorogation that happened in August. But there's a lot we have to do. There's a lot of work we still have to do. There were various witnesses and people who spoke to us about the tools we might need in the future. And there are so many of these things that I would like to explore. I would like to explore new ideas. You know, there's the issue of parliamentary protection and telework. I'd like to come back to that. I'd like to have an opportunity to speak about that, to speak about the importance of telework, and to talk about how family life balance has changed with telework. Because the differences are important. Sometimes one chooses to work from home, and other times one has to adapt to a situation by working at home. I'd like to talk more about that in committee. I have so many ideas. As soon as we can move on from this motion and move forward on a report and then roll up our sleeves and work together as a committee. This motion should not be here during a crisis. I don't want to insult anyone, but some points have been raised in this committee. And I think maybe some members haven't read the report or they've only skimmed over it. Because we clearly gave our reasons for proroguing in August. The report is well written, and I'd like to thank everyone who worked on this report, who worked on drafting the report. And how they had to, and worked on dealing with the various questions that came up. And so I'd like to speak a little bit about the report, because I think if I speak about the report, it will show us how relevant the motion before us may actually be. In the introduction, on the first page of the report, it's written that our government amended the standing orders so that governments going forward would be more transparent. And it says that the report will explain the reasons for proroguing Parliament. From the outset, it says that it will outline the reasons for the latest prorogation. We were the first government to table a report following prorogation. In 2015, our government committed to amending the standing orders so that our government and all future governments would have to be transparent before Canadians in all aspects of governance, including using prorogation. And so the purpose of the report was to provide clarity in the reasons why our government prorogued in August 2020. So this was a commitment that we made to Canadians, to all Canadians. There have been prorogations in the past, and never did a prime minister publicly explain why that prorogation was taking place. A report wasn't done to increase transparency. Every time there was a prorogation, questions were asked. But people had to come up with their own hypotheses. Some journalists, some reporters would say one thing, others would say something else, for example, that there was going to be a cabinet shuffle or that there were economic reasons.
It is important for us to explain clearly why prorogation is justified, and that's why our government provided a report on the reasons for prorogation. Prorogation was conducted according to valid reasons. The Prime Minister made the decision, applied to the Governor General, who agreed to prorogue Parliament. Thus enabling the government to reset its priorities. It became evident that during the first half of 2020 and in the speech from the throne that was given in the House of Commons, the old throne speech did not correspond to the new priorities of Canadians, and things are changing very quickly. It's an ever-evolving environment. We need to adjust constantly. For example, Every time Health Canada approves a new vaccine, there is not a single vaccine that can be stored in the same conditions as the others. The logistics of storing these vaccines is very complex. Storing 500,000 doses is very complicated. There's a whole logistics in terms of delivery to provinces, territories, pre-delivery arrangements. There are a number of organizations that were kicked out of community centers because community centers are required to organize vaccination campaigns, so they can't stay on the site. This has an economic impact. This has an impact on the population, on the public, organizations, and people who are going to get the vaccine. Each province, each territory has their own system, which makes the situation even more complex. But let me tell you this, the decisions that we're going to make this week can be changed or adjusted next week. So it became quite clear that the speech from the throne did not reflect this valid priorities. The cause for that was obviously COVID-19. So COVID-19 is a global pandemic, but it's also a global economic crisis. The report alludes to the difficulties that were facing the government and the need for the government to support Canadians. In March, Canada's GDP decreased by 7.2%, and the country lost more than 1 million jobs. In April, 11.6% for the GDP, and our country lost 1.99 million jobs. At the time the report was drafted, a lot of Canadians were experiencing financial difficulties and feared for their health. So the government set up programs to support them, to support caregivers, to support people who lost their jobs, to support communities, to support seniors. We tried to support as many people as we could. And once again, we have job losses because of COVID-19. I'm not blaming the provinces and territories for the restrictions that they're imposing. We've had zone systems with green zones, orange zones, green zones, and red zones. Declaring a zone a red zone comes with job losses, business closures, I have sugar shacks in my riding that were able to adjust to the situation, to adapt their activities, and to stay afloat. But a lot of them also had to close down permanently. So this illustrates the need for us to do more for businesses, and we need to act quickly to help these businesses go through the pandemic. So what about those lost jobs? Are those jobs that are going to be created after the pandemic? Well, I certainly hope so. But we do have the most stringent restrictions in all provinces and territories so that we can see ourselves through this pandemic. But even then, opposition parties blame the government for making decisions, sound decisions, drastic decisions in the face of the pandemic. We have been accused of being responsible for job losses, for not acting swiftly enough. I know I'm in politics for a reason, and I know I'm exposed to this. To be rebuffed from time to time, but I think we now have an opportunity to show the Canadian public that the PROC committee is in a good position to make sound recommendations to help see our country through the pandemic. I'm a new member on the committee, and I sincerely invite my colleagues to do their best to represent the interests of Canadians. I also want to make sure that the interests of French-speaking people are represented in the parliamentary procedure to improve the system and make things better for everyone. So I think for this reason, we need to drop this motion to draft our report so we can move forward with more important files. We responded to job losses, and taking a step back, we were able to think about how to do better for creating jobs and to ensure economic recovery. That's where our plan comes from, and several measures are going to be taken, but have already been taken. The best measures that we've taken were those designed to help small businesses in the regions. So, what is it? There are organizations that help businesses through subsidies, through coaching, through support for developing business plans, and they provide support to small and medium-sized enterprises. And during the pandemic, these organizations have been very proactive to help businesses reinvent themselves, adjust to the new reality by giving them access to the necessary funding, thus spurring job creation, innovation, the purchase of modern and new equipment, the acquisition of technology, increases in performance, and job creation. So economic development organizations have an essential role to play in helping our economy recover. Our government made sure that in spite of the pandemic, the relevant ministers were able to do their work in collaboration with economic development organizations so we could invest in the communities. We're not just focusing on job creation now, we are focusing on maintaining employment. Because it's one thing to innovate and create jobs, but it is also crucial to not lose the jobs that we already have, the levels of service that we already have.
When small business closes in small communities, it's the same impact as when a Walmart closes in Toronto. That has the same impact of that. Small businesses are important. We want to ensure that workers want to open their businesses in the morning and want to go to work and want to make sure that they can work for Canadians. It's very hard at the moment to have measures for all businesses. We know that some businesses will close, some won't survive. Some were already in danger beforehand. They were having structural issues. There was competitivity that had come into their market, or the market was going down because people didn't need their products as much. Reinventing small businesses will need government help, and we'll make sure that the government is there. we've asked ourselves those questions. We wanted to know what we could do for those SMEs. Bigger businesses in the food chain were hardly hit because of storage. In my writing, one of those closed in my area because products were not used as much during the pandemic. It's part of the impacts that COVID has had. We have had measures to support health systems throughout Canada. On March 11, 2020, the Prime Minister announced $500 million to the health system and to make tracing possible. We had to acquire equipment, and we've made that decision starting in March 2020. This equipment was to follow the virus, and with different tests that have allowed us to follow the virus, we've sent these tests to the different health systems in the provinces and territories. When it's said that the government hasn't done anything for health, well, since the beginning of the pandemic, we've been collaborating fully, and we've transferred all products needed by the systems to go through the pandemic. We've collaborated in certain provinces. We've sent the army. Also, the Red Cross has helped some broken systems. We know that 2 provinces had really bad outcomes, Quebec and Ontario. We had to help more so that the health system could be helped by the army, by our public servants, and so that we could support the broken system I've talked earlier about. We've implemented many programs and measures. Prorogation has helped to sit down and think about better working to go through the crisis. This helped support all the health systems throughout Canada. The measures implemented to help Canadians during the crisis were defined also during these periods where we were discussing and thinking about what to do. The MPs were the ears and the eyes. All questions from the opposition in the House of Commons or emails we've received and meetings I've had with MPs throughout the province on seniors, in my case, means that I didn't make a difference between the different people I was talking to. When we're talking about the seniors and improving the system, I opened the door as I've always done. That's how I was raised. The door was open for just about everyone so that we could help. As an MP, my door is always open. It's still open today in order to improve the lives of seniors. I've met with MPs from all parties. I've talked to MPs from the Bloc. We have constructive discussions. I also wanted to get proposals, and we've worked to try to improve things before the second wave. We knew that a second wave was coming up. We were all expecting it because of statistics because what we had seen through the pandemic in certain provinces and territories, we could see that things were getting out of control, that the health system was fragile, that beds were no longer available, that the staff on the front lines was tired. I'd like to quote a paragraph on page 5 of the report. When I found this, I thought that this was a key sentence. It's thanks to those unprecedented initiatives throughout the country, Canadians were able to flatten the curve before the summer. The fight against COVID-19 is not over yet. On August 17th, the day before prorogation, Dr. Theresa Tam has mentioned this. She said, right now, our efforts indicate that COVID-19 is manageable. However, the virus is still circulating in Canada. We must not lower our guard. The epidemiological curve, including the impact of COVID-19 in the fall, will depend on the measures we will take so that there's lower infection rates. Despite what Dr. Tam said, despite the situation we were going through at the time, we seem to have some control, but something else happened. It's funny, it happened in August. It happened at the same time as the prorogation, and we knew that there would be summer and good weather. And we knew that people would get together. There were no activities, no family gatherings, or we wouldn't be invited to festivals, music fests, and others. So we knew that that was not going to happen, but we didn't have a crystal ball at the time. Prorogation happened. I will use the English term here.
Timing. Est-ce que c'est le bon temps?
Is that the right moment? In August, when Dr. Theresa Tam at the Public Health Agency said that we needed to be careful and send clear messages to Canadians because we were between the first and the second wave in August, the doctor's good position to say that we needed to look at what was happening. If we had done this at the beginning of the pandemic, during the first wave, we thought that we were flattening the curve in the first wave. Maybe we could have gone through at that time. But you know how the Canadian systems are done. We have a lot of regulations on the approval of vaccines. We also knew at the time that this...
Yes, Ms. Vecchio?
Thanks very much. And Madam Chair, I know that we are getting close to the 1 o'clock spot. I know that after speaking to some of the whips and some of the other party members on this call, that we do recognize that there will be other committees that need to be heard today as well. And so I would ask that we suspend this meeting and perhaps suspend this meeting for now and come back to this issue on Thursday when we're normally slotted in for time schedule.
We have 4 more minutes. Mr. Luzon, is it okay with you if we suspend until Thursday? And is it if it's okay with you, then I'll just ask if we have consensus and we can do
Okay,
so.
as soon as I start on Thursday, because I have more to say a little bit.
Okay. Okay. I promise we will keep the list, the speaking order the same. And one thing I did want to mention is Ms. Pettypot Taylor and Dr. Duncan had gotten booted off the system and the order changed in what you see. So the order for Thursday would look like Mr. Luzon, Ms. Pettypot Taylor, then Dr. Duncan, and then Mr. Blakey. That would be the speaking order for Thursday. Okay, so we will suspend for today and reconvene on Thursday. Thank you.
Thanks, everyone.